Hi, today I want to share some tips on how to talk to your children during this very difficult time in our lives in the Twin Cities, in the city of St. Paul and Minneapolis, following the tragic death of George Floyd and the looting and the rioting that has occurred in the aftermath of his death. I just want to say it has been very tough for many of us, especially for those of us here in the Twin Cities, because this is happening in our backyard. And this has possibly made it even more overwhelmingly devastating because of what we've had to endure during COVID-19. I just want to say that I know that this has impacted all of us in one way or another. And I understand that this is a very complex situation with many different perspectives, varying passionate opinions, heated debates, and strong convictions. Everyone seems to have a thought or an opinion about it that feels justified in their own way. And so I'm not going to dive into all of these things, but I just want you to know that I understand there's been a lot of hurt, suffering, trauma, anger, fear, the list goes on. I just want to say that no matter what your take is on this, that we can all agree that it has been an extremely complicated issue and that it has been heartbreaking for many of us, if not for all of us. And so if we, the adults, are grappling with these flood of emotions, these emotions that are weighing our hearts down, and we're still trying to wrap our minds around and make sense of it, I'm curious how our kids are coping with it. Now, many of you may be wondering, how can I talk to my children about this when I can't even make sense of it on my own? Or many of you might be saying, if I talk to them about it, wouldn't that make them more anxious? Many of you might worry about saying the wrong thing. Many of you may just want to avoid it altogether. Not addressing this topic, however, will not make your child feel safe or protected. They are likely hearing it from other sources. Now, in the age of social distancing, those of you who have elementary age kids might not hear it as often because they're not around other classmates and they might not be exposed to the media as much. But I would guess that a lot of your kids are already hearing about it and seeing it on TV or especially on social media. So it is important for you to talk about it because it's better that they hear it from you than from other sources. So it's important for you to address it or name it at some level. In fact, one of our biggest responsibility as a parent or a primary caregiver is to teach our children how to cope with tough situations in constructive ways, how to sit with these emotions in ways that will build resilience. And it's important that your children receive guidance, assurance, information, and understanding to help them process through these experiences. Don't worry if you don't have all the answers. Now, before you sit down and talk to your children, here are a few important things for you to consider. Number one, it's critical that you sort through your own emotions as best as you can. It's important for you to evaluate these emotions because if you don't, it will make for a very difficult and perhaps unhelpful conversation with your child. If you have a partner or spouse, talk it out loud with him or her first so that you both know where you stand on this. If you don't have a partner or a spouse, talk it through with another adult so that you can sort through your feelings. It's also important for you to know where you stand on many of these controversial issues. What are your thoughts on racism, police brutality, Black Lives Matter? What's the difference between protesting and looting or rioting? What are your thoughts on why people do what they do? What are your thoughts on trauma, historical trauma, white privilege? These are topics that might not come up, but you must be prepared if they do. And it's important for you to reflect on the kind of lessons that you want to impart on your children. What are your core values? And what are some of those values that you want to raise your child to have? 2, be aware of how you're regulating your emotions. Now, feeling a whole range of feelings or emotions is normal. So there is no right and wrong in what you're feeling, but you have to be aware of how you're regulating your emotions and of how you're demonstrating or showing those emotions. You are modeling how to deal with tough situations through your regulation of emotions. So how you display your feelings, no matter what they are, will be key. 3, be honest. You don't have all the answers. You don't know what the future will look like. You can't make any guarantees. And you're feeling a lot of things. So just be honest with your child on that. The bottom line is that make sure what you say, what comes out of your mouth, reflects the life lesson and the values that you want to impart on your children or on your child. In talking to your kids, keep in mind that every child is different. Some may want to talk about it and ask many, many questions, and some may have nothing to say at all. Some might be overthinking it and be very fearful, and others might be disinterested. Some might feel anger. Some might feel sadness. Some might feel a whole range of everything in between. All of that is okay. So know your child, trust your intuition, and keep in mind that what's most important is how you talk to your child, how you model these conversations with them. Your job is to ensure that you've addressed this conversation in a manner that lets them know that you are there for them and that you will continue to be there for them. Also, keep in mind the age of your child, the developmental level of your child, and their ability to understand. Gauge your child, know your child. Make sure that you're tailoring your talk and the details of that to their age and their developmental level. So here are a few tips when you do talk to your children or your child. 1, make sure you are setting time aside to devote to this. Make sure there are no distractions when you are sitting down, because you don't know how much time this will take depending on your child or your children. It might be a 5-minute conversation. It might be an 1.5 to 2 hours conversation, depending on how things go. 2, start by asking your child or your children what they know about what's going on right now in Minneapolis and in St. Paul. Ask them how much they know. What you're trying to do here is you're trying to understand how much they know so that you can clarify if needed, add to if needed, respond to or support. Don't make any assumptions. And if you're answering, keep them brief and simple. They don't need you to tell them all of the gory details of what's going on or all of your opinions about it. So just keep it neutral and detailed and less overwhelming, because children could be easily overwhelmed. Again, depending on your child's age, you may say very little or a lot. So if they're teenagers, they might have more information than elementary age kids. And that might dictate how the conversation goes. 3, listen without judgment. Just being there and being present with them and acknowledging what they know, how they feel about it, and what they think about it will be very helpful for your child to feel supported, heard, and validated. 4, give them opportunities to ask any questions they might have of you or of the situation. Again, you don't have to know all of the answers, and it's okay to tell them that. Also, it's okay to share how you feel about it. in a way that helps a child to understand that it's normal to experience these emotions. 5, which I've already said, but I think it's super crucial to list it, is give just enough details so that your child knows what's going on. Focus on the general facts of what happened and really emphasize what you want your child to walk away from this conversation with. 6, so one of the bigger priority is to ensure your child's safety. Children are often very self-centered, and that's just how they naturally are. They will think about themselves first, and many will think about themselves and those that they love, so their family. And so they will wonder if they're going to be safe. And so as a parent, as an adult, a caregiver, you need to make sure as much as you can without making grandiose guarantees that you are going to do your very best to make sure that they're safe, that you are going to do your very best to pay attention to what's going on in the world. And that's not their job to do that, but that is your job as a caregiver, as a parent, to do that for them. 7, remember to ask your child how he or she feels. Now, many kids may not have the words to describe their emotions. Many kids might just say, I don't know, or I'm okay, I'm fine. And many might say, I'm confused, I'm scared, and all of that is okay. So remember that no matter what they say, validate it, normalize it, acknowledge it. And then try to model by using feeling words to express how you might feel. But some kids may not share a lot because they're still they still don't know all of the feeling words, and so that's okay too. It's important though to just keep the communication channel open and normalize that it, even if they don't know how they're feeling right now, that if they start to feel other things in the future, that you're always here and available to talk to them. So 8, keep the communication channel open. Let them know that this is the first of the conversation and it doesn't have to be the last if they're interested in talking about it some more as they sit with these emotions and these details. 9, for children who might have a better understanding of what's going on, who might know their feelings better, are more self-aware, have more insight, it might be helpful for you to explore and talk through some of the symptoms and the signs if they start to feel worse. So you may ask some questions like, how will you know if you're not feeling okay? And they might be at a loss, but you can say, like, for me, when I don't feel okay, I get really crabby, or I get really short with people, or I have trouble falling asleep, or I just don't really feel like talking to anyone. And really emphasize on your child paying attention to their body. It's okay if they start to feel not themselves as the days pass, but that you will be there to talk them through it. Lastly, 10, if you feel that your child is having more than the typical response to it, if their overall behaviors are very concerning, if it's disruptive and preventing them from doing the things that they normally do, please seek professional help and consultation. You can either call your health insurance and get referrals for providers from there. You can call your primary care provider's office or call the county, the mental health county, for more resources. And lastly, know that these bullet points or tips that I've highlighted do not necessarily have to happen in that order. Just really stay engaged and present with your child, and just make sure that these tips are touched upon as you're engaging in this conversation with your child. And finally, I just want to say that difficult times have helped us, have helped humanity to find courage, to find strength and resilience. So know that it's essential and critical for our children to learn how to cope with adversity in order to help them with their character, in order for them to be resilient. And in order to do that, it's important for us to sit with them, to sit with these negative, painful, uncertain emotions, to sit with that, with your love, your support, your encouragement, and your reassurance. This process will help your children to develop the skills necessary to cope through adversity. We have overcome many tragedies and adversities in our past. Humanity has always come out of this okay. And so we will overcome this one as well. Please stay well and take care of each other. Thank you.